I'd like to give the floor to Madam Chen Bin. Friends from the media, good morning. Now I would like to give you the latest progress regarding COVID-19 containment. First, I would like to give you the infected cases number. From 0 o'clock to 24 o'clock on April 5th, we had the 9 cases, and 6 is confirmed newly added cases, and the 3 asymptomatic cases. We all found them in the large-scale NAT, and we found the 3 from the local searching, and also the case also confirmed from the direct contact, and also 1 actually is before the asymptomatic cases, and 3 in Liwan Baihedong Street is already shut down area. Another 6 cases in Zhujiang Street of Nansha District from the May 21st to 24 o'clock, June 5th. Right now, we total reported 94 confirmed cases, including 80 confirmed cases and 14 asymptomatic cases. So far, all the infected people located and also treated at the 8th hospital. Based on the current situation, we already rolled out the multi-tiered containment measures. I would like to call on all the residents in the related areas. Please follow the local instructions and check your body measures, and also report your health condition, and also participate in the NAT. And let's work together to trial over this trying time. And one thing I also would like to say that the requirement on the hospitalization. If you would like to receive the hospital service and also show the symptoms of fever, fatigue, the running nose, the throat sore, and also diarrhea, please report your condition through the cold, and also if you are in the lockdown areas, and please report to your team. For the people in other areas, please visit the nearby fever clinic, and also please always wear masks, keep your hand hygiene, and do not take the public transportation, and also please report your travel history. All these information were already published on the various platforms, including the official account at WeChat and Weibo, and also at our official website. And third, I would like to let you know the citywide NAT. Based on yesterday's newly confirmed cases, and all based on the community level NAT, and also screen out of the close contacts, that once again demonstrate that the citywide NAT is a useful and powerful way to cut off the transmission of the virus, and also take the proactive action in fighting against COVID-19. Based on the unified action made by the local government, Chenghua, Guangdong, we already released the information regarding the local residents as well as visited people all be concluded in the NAT. So far, 11 districts already carried out this NAT, and started from the May 16th till yesterday, 24 o'clock. So far, we have conducted the 106 billion cases, and we screen out 38 confirmed cases. And regarding notification number 17 issued by the command center, in order to cut off the transmission of the virus and protect people's health and safety, the local government would release the following notification number 17. First, we control the travel and the people's movement, and we conducted the multi-tiered, the leveled the requirements, make sure that the people in the medium, the high level risks, they not go out. And for the people in the control areas, only people allowed to enter, not allowed to enter, and the people not encouraged to leave Guangzhou. And if they need to leave Guangzhou, they need to hold the effective certification of their NAT in 48 hours. And if that we also ask the travel agencies to help us to control the movement of the people. And second, regarding the railway, port, transportation means, and we also guide the traffic, make sure that there's no mass the gathering, and also check the travelers' information for the hail cars, the taxis. Passengers and the drivers should all wear masks, and also drivers should conduct the ventilations, and also the staff involved in all these transportation means should be protect themselves. And for the passengers should always show their code, and also the people with red or yellow code are not allowed to take on the vehicles. Third, regarding the vehicles, people in the controlled areas or stay at home for quarantine, they should practice all the requirement measures, and they should protect themselves and also participate in the health check. If they not follow all these guidelines and cause additional risks, and they will be held accountable. And fourth, regarding information report, if in the past 14 days, people with travel history to the medium and high risk areas or the restricted areas, they need to report their travel to the local community and also participate with the following checkings and also the NAT. And people with the red or yellow code, they should receive their NAT on the same day and report their results. And all the information should be the genuine. If we found this disinformation, these people should also be held accountable. And fifth, regarding NAT, please participate and also cooperate with the NAT, make sure that no one left behind, and also please conduct the NAT in a well order, and also keep the social distancing and wear masks. Six, we also control the restaurants. We also asked the people that the also take the measures. We not discourage people to conduct the CGTN eating, and we also encourage people to take them out, and also for the university, for schools, and for the companies, and also conduct that the people to conduct the eating routine in different groups and in a staggered manner. For the meetings and other activities, we encourage people to conduct online mode, not offline mode. And if it's needed to conduct offline mode, then people should know their role and responsibility and control the traffic, and also have a limited number of participants, and also practice all required measures regarding COVID-19 containment. And for the medium and high risk areas and also places with restricted requirements, all the practice should be followed as the notification 15 required. And for the other places, also need to conduct the appointment, and also should be in a staggered manner, and also the masks and other hygiene practice should also be strictly followed. And also for the personal hygiene, we still encourage people to keep their hand hygiene, to cook food well before eating, and also use your clothes to cover your nose, use your squeezing, and also please keep social distancing and wear masks, and also please check your body health if you show any symptoms, and please report your health condition via codes. And also always wear your masks and protect yourself well. And also if you show any symptoms, do not take the public transportation, and please visit the nearby fever clinics as soon as possible, and also tell the epidemiological history to the doctors. All these measures will be changed in a dynamic manner and will be in effect as we announced now. Thank you. Thank you very much, Madame Chen Bin. And she gave us the latest progress regarding the infectious numbers, and also the updated notification regarding the hospital service, as well as the citywide NAT. especially that notification number 17, and also that the content is keep updating, and there are a lot of content information included in this notification, and we control the people's travel, and also we control the travel means and also the travel locations, and also we look into the places like restaurants and also sitting in the restaurants, and also we look at the canteens at the schools and also the companies. And two things I would like to highlight. So we not encourage people leave Guangzhou. If you have to leave, you need to hold a 48-hour valid NAT certificate. It will be put in effect on June 7th, 12 o'clock. And also we talk about if your health code in yellow, you need to receive your NAT on the same day and report your result. All the information should be genuine. If you fake your information, they will be held accountable. For the detailed information, please check the official website. Thank you. Welcome, Madam Shen Ying. Friends from the media, good morning. In order to control the travel and cut off the transmission of the virus, and on May 30th, the command centers issued information regarding control the travel and also vehicles, which is also we talk about as notification number 14, and we also practice temporarily measures on the vehicles and the transportations. For notification 17, there's a little modification based on a modification on the 14. We talk about that the 12 hours valid NAT certificate right now is changed to 48 hours valid certification of NAT. And also, so tomorrow, 12 o'clock noon time, you need to hold your 48 hours valid NAT certificate in order to leave Guangzhou. Since the notification release on May 30, first, we focus on the containment requirement on the airport and also the road stations and also the bus transportation areas. We have the people on position to check the passengers the green code as well as their NAT. And at the Terminal 1 and 2 of airport, we also have specific areas to check the code and their health condition. And we have 3 to 5 people plus the volunteers to help us check the information. And for the travel agencies, when the passengers book the air tickets, and they also have the notification regarding NAT to the passengers when they're booking online. And for the railway station, we also have 54 additional personnel to the North Station and also to the other stations, also with additional headcount to check the containment requirements. At the road transportation, we closed Fangcun, Jiaokou stations, and from the June 4th, we also stopped the inter-provincial service. So from the June 4th, we already stopped the transport service to other provinces. So right now we can see a decline in the travel numbers. Every day we provide the service to 910,000 people. Compared to May 30, the number dropped 33.6%. For railway, the 690,000 dropped 61.4%. For airport, the 170,000 people dropped 64%. For the road transportation, the 50,000 people dropped by 78.4%. So, which means that we strictly practice the notification. And regarding the passenger cars, and for the expressway, highway, and national expressway, we already established 38 checking points for people leaving the Guangzhou where there are passenger cars. So we also practice the stringent measures for the people entering to the stops. and especially the cars from Guangzhou and Foshan, we also check them information with more attention, and we also have the roadblock to help us to check and also use the big data and also the mobile phones. If we found that people not follow the guidelines, we also issue the warnings via the phones. And we also have the notification along the road, so people will help them to raise their awareness. For every day, around 1.3 million cars passing the stations, up by 1.2%, but right now there's 310,000 cars leaving. Guangzhou, and we also see that because of the COVID-19, people choose leaving the Guangzhou or the cities by cars. So the number 14 notification also is a very effective way to control the spread of the virus, and also regarding the trucks and the truck drivers, for the delivery station, we also established the places for the NAT for the drivers of the trucks, and so far we finished around 220,000 samples collection, and going forward we will continue to practice all these measures and also control the movement of people in order to mitigate the risk of spreading the virus, and also encourage people not to leave in Guangzhou if not necessary. If you have to do so, once again, tomorrow noontime, you need to hold 48 hours valid NAT certificate. And also, if you want to leave Guangzhou, please always pay attention to your destination, the COVID-19 containment requirement. Thank you. So Madam Shen gave us the information regarding the practice of notification 14 and also the notification of in the notification 17. And we also invite Mr. Xie Min from Nansha District. I believe the friends from the media may have questions to our speakers. Now the floor is open. Nanfang Daily. A question regarding to Mr. Xie regarding the latest progress and measures taken in your Nansha district. Will you please give us more information in this regard? Thank you for your question. I also would like to take this opportunity to express our gratitude for your attention and support to Nansha district. In our active screening work in Nansha district, in the evening on June 4th, we found a sample, a suspected positive sample. So we initiate the COVID-19 containment measure and closed down the Jiang'an Park area, and so conducted the epidemiological investigation into the suspected positive case, and also we practiced the disinfection in that community. The local government attached great importance to this case, and also the leadership also on site to look into the situation. And for the Nansha district, we also organized 10 working teams to intensify our efforts to curb the spread of the virus. Just now, Vice Director Madam Chen Bin already gave you the updated information. And to your question, let me give you the measures have been taken in Nansha district. In the evening on June 4th, we received the emergency report. In the Jing'an Park Native Station, we had a suspected positive case. And in that evening, that's a mixed testing. So we found that 5 people and also conduct the one-on-one designated tube of NAT to check again. And also we look into the environment and also conduct a disinfectant work. And also we practice the epidemiological investigation into that possible case. Based on our primary learning, a couple with surname Zhang, they visited a restaurant in Liwan district. As Madame Chen announced, the newly confirmed cases as well as the asymptomatic cases and all the family members with the confirmed cases. So far, that's Mr. Zhang's or Madame Zhang's family. In total, 6 people right now are hospitalized in the number 8 hospital in Guangzhou. After we double check on that positive case, as well as requirement on the COVID-19 prevention and control work, we initiated our level 3 emergency response system. For the Jing'an Huayuan with positive case found, right now is under a lockdown. We required all the residents in this community stay at home, and every day they will receive 1 NAT, and the practice will last for 7 days. And we also have a designated place. That's also the restricted places. So the people allowed to enter but not allowed to leave. So this is the 1 lockdown place and 1 restricted places. And for the other places in our district, there's all practice the stringent measures. So require people stay at home, and also they need to go to the working place. Then that will be point-to-point travel allowed. And also for the confirmed cases family, we learned the epidemiological investigation and also checked their 14-day travel history. So far, we screened out 93 direct contacts and also the around 248 secondary direct contacts, and these are now under our observation, and also conducted the environment disinfections. And for the Jing'an Park community, and around more than 4,000 people received their NAT. In order to find the further confirmed cases, we also initiated the district-wide NAT. So far, we mobilized 2,809 health personnel and also more than 550,000 volunteers to help us organize this district-wide NAT. And just in a half day, the local government also dispatched 2,400 doctors and nurses to help us conduct NAT. We do everything we can to roll out this NAT test. Just within 12 hours, we basically finished this NAT work, covering all the residents in our district. And would like to say a big thank you to the health personnel, volunteers, as well as people all involved in this endeavor, as well as all the residents for your participation. And so far, we've collected 824,132 cases. So far, 210,000 cases already have the results, all negative. And we also checked the environment samples. We only find samples positive in that confirmed cases family. The other environmental samples all are negative. From 0 o'clock on June 5th, and we stopped all the transportation, including the road transportation and also the bus transportation. Going forward, we will continue to practice our containment measures and also to manage these close contacts, as well as the management work in the closed down lockdown area and restricted areas. We will continue to carry out NAT and also to identify the close contacts and trace the close contacts, make sure no one left behind. And also for the lockdown area and also the people in the restricted areas, please help us. And we will also do everything we can to make sure there's sufficient supply of daily necessities and make sure that nothing is impact to the people living in the lockdown or restricted areas. And we would like to make sure that there's a harmonious and well-ordered living environment in Nansha district. And also ODA practice will also be changed in a dynamic manner that will be based on the result of the district-wide NAT results. And we will also double our efforts to mitigate the impact to our local economy. Thank you. Thank you. And for Nansha, I believe that the people attach great attention to the situation in Nansha district, and we will also heed the views from the public and also answer your concerned questions. With CMG CCTV, my question to Madam Shen. We talk about if people like leave Guangzhou and they need to hold a valid certification for 48 hours. So yesterday, if we found people want to leave Guangzhou, but they not really hold a required certification, then what kind of measures will be conducted to this group of people? And we encourage them going back, or what else we can take? Thank you for your question. So the work actually already started yesterday afternoon at 4 o'clock. So as I said, that from tomorrow, 12 o'clock, that the requirement will change from 12 hours to 48 hours. So for the people living Guangzhou, we not really check each and every cars because we also have a big data to help us. And for that, the joint checking stations and for the cars from Foshan and also for the code in yellow and also for the people in with the 48 hours valid certificate, that we encourage them to go back. And we also will post that the text message to ask them that if not leave, then please stay. And if they already left the city, then they need to be in quarantine and also follow the local practice in containing the virus. So once again, I call on everyone to participate and also to cooperate with us. If people not really meet all the requirements, please not leave. And if you have everything in hand, and please follow the local requirements. And for the passengers, it's still allowed to travel within the province, but you're not allowed to leave the province. But still, just like Nansha, right now they also have the new condition on the passenger cars. Please always pay attention to the updated information. Thank you, Madam Shen. I believe everyone actually quite keen to know the latest information regarding the situation in the COVID-19 prevention and control measures. We can tell you that all the people, especially people working on the community level, they race against the virus and they work day and night in order to control the virus. And also today, based on the requirement of our reporters, we also invite the people on the front line, including doctors, nurses, and the delivery personnel, to let their voice heard. And also like to let our media reporters to help to express their voice. That will be our second part of today's press conference. All right. Just now we concluded our session 1 of today's press conference to give you the updated information regarding the containment work in Guangzhou, and also we learned the latest information and measures practice in Nansha district, as well as the newly released the notification number 17. And we know actually people across these sectors are involved, and that including our personnel on the front line, as well as bus drivers, and also our delivery boys, and also our college students. No matter which industry they come from, they all work for the community. They are the volunteers on the front line. Because of their hard work, we created that synergy and also built a fortress against the virus. That is why today we invite some of the representatives from different industries and sectors to share with us their experience. So the next session will be conducted online and offline. So here with us we have Mr. Chen Fei from Local Post Administration, taxi driver Mr. Zhang Zhenxing, and volunteer Madame Huang Qile, and also Mr. Xie Dongxing from the local volunteer team. And later online with us, we have the frontline Madame Shi Lihua on the front line in the restricted areas, Tang Min, and also we have Mr. Wang Yunjiao, Mr. Hou Yangyang, so the delivery man in the restricted area. Now, first, I give the floor to Mr. Chen Fei to brief us on how a postal service deliver the parcels to the restricted or lockdown areas. In face of the sudden coronavirus, the Postal Service shoulder our responsibility to make a swift actions, make sure there's nothing stopped our service. So first, we protect our staff and also practice the requirements of the COVID-19 containment. And also we focus on the vaccination of our staff. So far, for the frontline workers, nearly 90% of them are already vaccinated. And we always practice, as we are in a wartime, and also conduct the disinfection work in our work environment, make sure that we protect our customers and also our staffs. Second, we also opened a green channel for transporting the anti-epidemic supplies, and we carry, transport, and deliver the anti-epidemic supplies to each destination. So far, 800 boxes, 50,000 supplies delivered to the front line, including Foshan area. For the drinking waters, also delivered to Liwan district, donated from the local companies. And third, regarding the delivery service in the restricted or lockdown areas, within Liwan district, 3 postal stations operate in the normal manner. And we also mobilize our staff living inside the restricted or lockdown areas to organize a temporary team, and we also have seen that growing number participated in these delivery team. Regarding vehicles, venues, it will be guaranteed. Going forward, we'll deliver more the anti-epidemic supplies as well as daily necessities. Third, we also seen our staff actively participate in the delivery work. In the places, and also make sure that the service will not be stopped, no matter in which places. And tomorrow is a big day for students, and tomorrow is the university entrance exam day. We also prepared for tomorrow with the vehicles and the drivers already in place. Make sure that the exam papers will be delivered on time, and also wish all the students good luck. And we fight with everyone together. On behalf of the Postal Administration, I thank you all the staff for your hard work, and also thank you everyone for your understanding and support to our work. I also would like to take this opportunity to call on everyone that we have a big burden on our delivery service, and please do not stockpile way too many supplies in your home, and also make sure that do not buy a lot of things that you would like to ask for refund. Thank you very much. As Mr. Chen introduced, that they organized a specific team to deliver the service to people living inside restricted area as well as lockdown areas. And later on, we will also have a delivery man online to give us more information. There's a touching story went viral online. It's a bus driver and taxi driver, and the taxi driver knew that the passenger is a frontline medical staff. They said that I will not take your fee because you work really hard on the front line, because you protect the whole city. And today we invite a taxi driver, Mr. Zhang Zhenxing. So as a taxi driver, how he took his actions in the battle against COVID-19. Hello to all. My name is Zhang Zhenxing, 56 years old. I'm a taxi driver. I'm originally from Hubei, but I'm here, worked for Guangzhou for 21 years. I'm already one member here in Guangzhou. As I remembered last year, everyone gave us great support to my hometown. And today, as a taxi driver, also with our great love and passion to this city, I also would like to make my contribution to the fight. Because the virus actually really impact people's travel, and tomorrow is a university entrance exam day. In order to make sure our students can arrive in their examination venue on time, for our company, we organized a fleet. As a party member with 120 drivers of buses and taxis, we delivered point-to-point delivery service to students. And we also conduct disinfections and make sure that we will escort our students to their examination venue. Actually, I'm just one of the members of the drivers of buses and taxis, although we're from different places, but we all would like to make our tiny communication and the contribution to this fight. And there are a lot of touching stories happened. As we saw that video clip, Mr. Yang actually was the driver, and it was really that Mr. Yang said that you were the frontline personnel and you devoted so much on the front line, and I will not take your fees and just take a good rest at home. And 2 days later, on June 3rd, another taxi driver, Mr. Liang, also rejected to receive the payment. That's the passenger is actually the reporter from Beijing to Guangzhou. Actually, that's Madame driver. And yesterday afternoon, and 3 nurses took taxis to support the local NAT work. And the driver surname is Fan also say, I will not take your taxi fees. Like the medical personnel, like reporters, they work really hard on the front line. But for the drivers, actually, we also make our contribution to support Guangzhou in this fight. Tomorrow is the university examination day. Wish everyone a good luck. Thank you. Thank you for Mr. Zhang's sharing. That's not just represent himself, actually he represents and also make the voice of all the drivers of buses and taxis heard. So for the taxi drivers and the bus drivers, they provide service to our reporters, to our frontline, the medical personnel, to the front line. So it shows like people hold hand in hand in this battle with COVID-19. Right now, in 11 districts, we had the NAT work going on that involved a large number of volunteers on the front line and in these NAT stations to make sure all the work will be conducted in a well-orderly manner. So we'll talk about volunteers play a key role in this regard. And today we invite 2 volunteers here to let us know more about the work on the front line. I first invite Madame Huang Qile about her work in the Haizhu district. Hello, my name is Huang Qile. In the recent disease prevention and control work, my colleague and I actually recruit volunteers and organize volunteers and also to conduct our work on the front line. I would like to share with you my feelings and the stories happened. On May 30th in Haizhu, we started our first round of NAT. So far, we organized 5,000 volunteers involved in NAT station to provide service. And we provide around 20,000 hours of work. Lujiang Football Court actually one of the largest place for NAT. There will be a large number of people waiting there for NAT. So on June 1st, 7 a.m., I received a phone call asking for additional volunteers. So just within half an hour, around 135 volunteers raised their hand. Around 46 volunteers arrived on site immediately and provided service. For the residents in the Haizhu district, it was very cooperative. In the lockdown places, a key job for volunteers is how to help people deal with their issues found like staying at home. Within 2 hours, 7 households and also joined with us and to deliver the daily necessities, fruits to the lockdown household and local residents. And one of our volunteers actually still on the post at the late evening, and then he also showed up himself very early the day after. And for that volunteer and his parents actually also they work on frontline. I believe his parents' devotion actually really touched that person. I believe that has also helped them to gain that sense of happiness. So he worked with the parents on the front line to fight against the virus. Actually, this is not an easy job, but actually, as long as we could make our contribution to help the local residents, then all our hard work is paid back. And we also that the saying that people donate the fast dry clothes to the frontline workers And also the volunteers also text me that I have the masks. Do you need that? And also the companies saying that you are volunteers. I have the anti-epidemic supplies as well as the drinking waters. I would like to deliver all these to the front line. So these kind of stories happened every day. And also help us to see that the power of our work. As to be party members, I would also would like to let a flag flying high on the front line, and we see more people join our big family of volunteers. Thank you very much. In Madam Huang's sharing, that's the each individual stories, but in together it shows that how individuals' behavior can be powerful. And also that in the story, it's the volunteer and also the parents, also the medical personnel working on the front line. I believe that's also the spirit carried forward in that family. So I would like to say a big thank you to all the volunteers. I also would like to give the floor Mr. Xie Dongxin. So he would like to talk about the youth reserve team of volunteers. Hello. I actually in this volunteer work for 14 days, and this time in order to support the Guangzhou volunteers' work, we helped to organize the emergency reserve team of volunteers and based on the system of the province, city, county, and village levels. We received orders from the different district places, and we dispatched the work to different volunteers and their teams. And we provide the point-to-point service matching, and also dispatch volunteers to provide service to different places. As of June 4th, so far we had 23,000 volunteers in Reservoir, and we mobilized 84,000 people involved in the disease prevention and control work, provided 460,000 hours of work. We have around 254 members. 70% of the members below age 35 years old, and the youngest one 18 years old. Within 1 week, had 1,000 people on the post. We also mobilized volunteer support Yuexiu district, Haiban, Baiyun, Yixu, and many districts and streets. Organize NAT work, make sure that they receive the call in 24 hours, and once they arrive, they can fight. We also have different teams, provide services, and also the volunteers, they also receive the trainings, and also we received insurance. And also we received NAT, and also health condition also under monitored. So one story, quite deep in my memory, is 2 days ago we experienced quite extreme weather condition. So the two elderly people in wheelchairs and one with a walking stick waiting for help. So I moved the barriers on the road and also opened a channel, a green channel, to let them walk in, so their information is registered and they appreciate our help.
他们离开的时候，在外围给我竖起的大拇指。
Because that's a big showering happened, and although I'm totally white, but actually, when I saw that they raised the sum to us, I was very touched and I really appreciate. I believe this is a city with love. As long as we work together, we could prevail over this hard time. Fight on, Guangzhou. Thank you very much for your introduction regarding the reserve team of volunteers. As we talk about the Guangzhou, actually a city of volunteers and also one of the earliest cities to organize a team of volunteers, and also a brand name of Guangzhou. And also people also touched by that neighborhood help. Today we also invite our guests online, especially our people in the restricted areas and the lockdown area. So first I give the floor to the Health Commission of Liwan District, Madame Shi Lihua. So our question regarding the urgently needed hospital service, how they can receive, how the local residents receive the hospital service.
大家好，自6月3日荔湾区强化分级分类管控措施以来，为妥善解决封闭分控区域。
Since June 3rd, Liwan District have practiced the tiered disease prevention control measures, and we have worked in the following 3 areas to meet people's needs in hospitalization service. So first, we have designated hospitals to give the service to the people in this area. For the people that's with symptoms or the pregnant patients. So we organize the hospitals. So for the separate the people with fever or with no fever. So we have a group of 3 people. That's a local community. And for the people, if there was the urgent case, like the cerebral infarction, and they call the 120 emergency numbers, I will send an ambulance to them. And we also have our hotlines available, and we also released on our official website, so the local residents can check our official account for more information. And for the people, and also for the lying the women or the pregnant patient, we also have the measures, and we provide service door to door, and for people with the underlying disease, a community medical team will deliver the prescription door to door or conduct the pre-triage in their family, in their household, and if they need to receive the hospital service, and we will also transport them to the designated hospital. And third, we also dispatch the experts from the key hospitals to establish a network. So far, 650 medical personnel involved in the community level. So far, all the clinics and hospitals are in operation. We also have the doctors and nurses stationed in the Liwan district. And based on the actual needs within the district, we will also mobilize the available resources in order to meet people's basic medical needs. Thank you. Thank you, Madam Shi Lihua.
你们呢可能要及时的发信息，特别是公众可以经过我们的公众号查询的信息能够广泛的发给我们的市民百姓，让他们通过我们的小程序、我们的信息平台，可以及时。I
believe later on we will see more information available online on the a mini app or the official account. Thank you very much.
有请荔湾区妇幼保健院副院长唐明女士来给我们介绍一下，在我们重点。
I'd like to give the floor to Madame Tang Min, Maternal and Child Care Service Center in Liwan District.
我们的医疗资源，还有呢，我们的老百姓通过哪种渠道和方式可以直接找到我们的这些医疗资源，然后呢，他们可以为他们提供更。
And how the local residents can find the available hospital service. Thank you very much. Hello all. So a hospital, the maternal and a child care service center located in the southern part of Liwan district and also in the restricted area as well. And we'll do the following work. First, we have to check the pregnant and lying-in women in the district. In the morning of June 4th, we initiated our app to screen out all the pregnant and lying-in women in the district. So far received 2,441 patients. And for the local patient, they scanned the code entered to our mini app, and they also will establish their files online, register their information, and we receive their information, and we will escort their whole journey of their pregnant. And we already released the information not only on our own platform and also on the other WeChat official account and also local community level bulletin to release this information. So basically we have this. This is the mini app available. And second, we also established that a working process in order to guarantee the service available to the pregnant and lying-in women in the Liwan district. And we also give a notice to the local community as well as the medical team. So they will conduct their DH check, and also we will also transport the patients to the hospitals if needed. In emergent case, and also the pregnant and lying-in women also can call the emergency numbers 120. Right now, we have 64 beds available, and we also can expand it, the number of beds to 80. And right now, we also worked with different teams and hospitals. So they also sent their doctors and nurses to Livan district, and we also dispatched the doctors and nurses to different communities in Livan district to provide service to pregnant and lying-in women. And also for the doctors, and also especially doctor from the pediatric department, they all on position, and we actually will do everything we can to guarantee our service available and also always available to our patients. Thank you very much. Just now we heard the medical resources availability in the local maternal and child care service center, and also we have the information available on our official account and also in the mini app. And also would like to ask today's our friends from the media to express this information via your platform. So I believe people actually in the Livan district and also in other places know how to register and also how to find the available medical resources. And now I would like to give the floor exchange students from Macau University of Science and Technology. And right now studying my doctor degree, so it's an exchange student. By the end of May, a local infectious outbreak happened. So as a student, I also register myself to be a volunteer on the front line. I also be one of the volunteer team here. And we had a lot of a touching story happened. To give you an example, and this is the Guangdong sports stadium. And with the team arrived here, this the area because the situation happened in urgent mode, so the few helping hands available. But after the announcement, actually volunteers registered themselves and on their way to this location. And to the maximum numbers, we had more than 100 helping hands here. And around 200 on June 5th. Actually, there were a lot of the story happened. And in Guangdong Sports Stadium, we have the volunteers, now the young faces, and also the silver people actually be one of our volunteers. And we have the lady in her 70s. So that was like her. We also had the silver helping hands. Actually, they stayed to the post till the very late night, and they actually also help us to do a lot of logistic work. So that was a very touching story. And also on June 5th, Guangdong Sports Stadium also received a special guest, a silver person in 80s from Germany. And also because of language barrier, and also without the Chinese ID, he could have actually encountered some problem, but actually we helped him. And he also shared with us like he visited many other places. Actually, he saw that the China is like a nation with love, and also it's a really strong mobilization capacity, and also it's like a strong power of people. And also he said like he liked traveling, but actually he would like to choose to spend the rest of his life in China. As we received a big thumbs up for our hard work, and we still received a phone calls asking whether we need the supplies and other donations. Actually, that's also the love. So this is a war without smoke, but we have a lot of heroes in this battle. I believe actually this city of Guangzhou is a heroic city and also city with love. We will for sure win this battle. And also tomorrow is a big exam day. I wish all the students good luck, and you can go to your ideal university. Thank you. Thank you very much, Mr. Wang Yingqiao from Macau University of Science and Technology, and exchange students in Guangzhou. So based on his own experience, and he actually talked about his work as a volunteer. You could see he's in a volunteer uniform to shoulder responsibility. And we also actually, from his stories, actually we heard a lot of the unknown volunteers, but they devoted themselves to helping the city and asking for whether you need additional help. And also just in his story, he said it's a silver lady in the 70s and worked with students as a volunteer. Thank you for your sharing. And also, please pay attention to your own health. And also, please say a big thank you to that silver person.
接下来有请广州邮政，现在正在我们风控管理区域内的投递员侯洋洋。
And now I also would like to invite Mr. Hou Yangyang, a frontline delivery personnel, to share your story. Hello all. Virus actually took a big toll on our service, but still we have more solutions than obstacles. So since the outbreak of the pandemic, we organized a team. So a team of 6 people actually we shouldered the workload of 23 people. Every day we dealt with 18,000 parcels. 3 times of the normal day workload. The limited hands. So we reorganize our work and reorganize our delivery route. So we established a contactless delivery post, and also the local residents quite understood us. So I'm still very happy that I can contribute my strengths. And on June 4th, and the areas became restricted places. Although my family members are a little bit worried, I told them that actually I'm here with all the accommodations and also food provided. So I'm safe, and also I received NAT. So with me, we also work with other colleagues, so we can have a FaceTime with our family members. And actually, my kids always say like, "Daddy, you're very brave." So that's also a big courage to me. So right now, actually, we live here in this post station. 6 of us actually work from 5 a.m. We first conduct a disinfection, and in the evening, we also actually work a little bit longer time. So 6 of us actually shouldered 23 people's workload. And in these days, we also delivered the anti-epidemic supplies as well as daily necessities to the volunteers on the front line. And also in our work, we also saw like the frontline medical personnel actually they wear their protective suits. They work really hard on the front line, and also we believe actually we can like deliver faster and deliver more to them. And also our work is not hard compared to the frontline personnel. We will stick to our post and deliver the anti-epidemic supplies to the hospitals. And make sure our work should be happened perfectly safe and shoulder our responsibilities. Thank you. Thank you very much, Mr. Hou Yangyang. Share with us your work in the restricted areas. Right now, is 6 people with more workload. Deliver the anti-epidemic supplies and the daily necessities. But please take care of yourself, protect yourself well. And also I'm very glad to see your family quite understand you. So today we invite our guests online and offline from different sectors, including postal services, or DA transport, or volunteers. So in total, 8 guests. They are each individual, but they all represent a bigger picture here happening in Guangzhou. We have a lot of behind-the-scene heroes. And some of them not really in the volunteer team, but they still paid their contribution, make their contribution to the fight against the virus. Still a long journey ahead of us. I hope we can hand in hand to prevail over this trying time and join the volunteer team. And we can win this battle against COVID-19 in an early date. Thank you all. Thank you all our friends from the media. And this is the end of the press conference. Thank you.